when it comes to herbs, Chinese herbs are a bit more complicated than Western herbs. In Western herbology, there's a tendency to give one herb for one symptom. In Chinese medicine, we practice what's called polypharmacy. And so we diagnose you with a pattern that takes into account your whole body, and then we give herbs for that pattern. It's hard to give you just fertility herbs because they're all used within a herbal formula. And at a practice like Unova, for instance, we make a different herbal formula for every patient, and we modify it and change it as you change, which really is the gold standard. But if I had to mention some herbs that have a long-standing tradition of being used in fertility medicine, there is, of course, Blakeway, Angelica, which you can buy over the counter in health food stores. We never prescribe it singly like that. We use it as part of a formula, but it increases blood flow to the uterus and it balances hormones, it balances estrogen and progesterone levels. It's a very useful herb, for instance, for PMS. We use it in all sorts of other gynecology, but it's also a useful fertility herb. And the other class of herbs that I often lean into with my fertility patients are adaptogenic herbs. And people often wonder, what are adaptogens? They seem to do everything. And what they are is they're herbs that help your body modulate and adapt and coordinate when there's change. So the most famous one is ginseng. Astragalus is another one. Reishi mushrooms, all sorts of medicinal mushrooms are adaptogens, as is ashwagandha. And so I often pick one of those adaptogen herbs and I put it in a formula for patients when I'm creating a fertility formula. Moxa is a herb. It's artemisia. It's a type of sage, and we burn it over or sometimes on acupuncture points. To add to that we don't burn you at all, but we do heat the points. And what's interesting is when they research moxa, it has a deeply penetrating infrared effect, deep into the body, more than you would ever think. So we use moxa over the uterus. If we are warming the uterus, we only do that in the follicular phase. We wouldn't do that after implantation, for instance, because we don't want to move anything around at that point. We want the embryo to just burrow into the endometrium and take root. But we often warm the uterus ahead of that by using moxa. We also use it on specific acupuncture points. And sometimes we send people home with a moxa stick, which is like a cigar of moxa. And we have them hold that over their points, specific points every night in order to warm them up. We give our patients herbs in tincture form, little droppers. They're made for us especially in California, and we know there's no lead or mercury or pesticides in them, so we like to do it that way. There are lots of different ways of taking herbs though. You can take them in pill form, you can take them in powders that you add hot water to, or you can actually brew up the raw herbs, which is what I do at home, but I never expect my patients to do that. One of the things I want people to know is that it's not a great idea to combine herbs with your actual fertility drugs. It's like asking your doctor to do the job with one hand tied behind their back, you know? They don't understand what we're giving you. They're measuring blood levels in order to understand the effect of what they're giving you. So what we do in our office is we like to give people herbs in the 3 months before IVF and then stop them about 5 days before people start their fertility drugs, their follicle stimulating drugs. Holistic treatments can't solve everything. I wrote my book, my first book, Making Babies, with a doctor because I really recognize the value of Western medicine and Western medical fertility treatment. And I think I like to see myself as part of the jigsaw puzzle. I'm not always the whole jigsaw puzzle. So be wary of people who promise you things that are unlikely to pan out. So for example, in all my 25 years of practicing, I have never been able to make a great big fibroid go away. Yeah, it's very substantial. If that fibroid is in the way, you're going to need surgery. Yes, a surgeon is going to take that out for you, and that's going to work much better. I can shrink them a bit with herbs and I can stop them bleeding, which is useful, but I can't just magically with acupuncture needles make them go away. So look for a practitioner who understands their field deeply, but also understands their own limitations and refers to doctors where possible. One of the things with experience that I've learned to do is I refer people earlier than I used to do to doctors. I realized that why wouldn't we get as much information and have as much testing as we possibly could early on? I send my patients fairly early on to a reproductive endocrinologist to get sort of baseline testing done and make sure there's nothing that I've missed that needs treating by a doctor.